Thanks for getting back. We're in the irritable bowel syndrome series, and now we're going to talk about the best treatment for IBS. So we're going to try and put a few things together here. If this is the first video you've seen in the IBS series, I'll just tell you what we've already done. What is IBS? That's one video. The causes of IBS, signs and symptoms, tests and diagnosis, best diet. Now we're going to talk about best treatment. So the best treatment for IBS, in my mind, is to first identify the cause, to try and find out why the hell you've got this problem. Okay. If your marriage breaks down, or your business relationship breaks down, or something happens to you, wouldn't you like to know why that happened? Or would you just go from one failed marriage to another? Or be someone like Zsa Zsa Gabor and have like 10 marriages, just keep marrying people for the sake of marrying people. If something happens, an intelligent person will want to find out why it happened, so they could stop that happening, again. Unless, of course, you win like the lotto, or we want to know how you can win it again, But I mean, if you got sick, why did you get sick? There's a reason why you got irritable bowel syndrome. It didn't drop in your lap like a plague of locusts, all right? You got IBS because you created the IBS. Now, was it a pharmaceutical medicine you took like an antibiotic? Was it a hugely stressful, perhaps a marriage breakup you went through and you hit the bottle for a year or something like some people have? Something caused IBS. So rule number one is try and identify the cause. That way you'll be able to, I think, get your health back a lot quicker and prevent recurrence of IBS. The best treatment for IBS will take into account lifestyle and diet and eradication of any unwanted bugs. The next video I'm going to talk about supplementation and IBS. But this one's more about putting the whole thing together, okay? So, a very important seminar I went to in 2003 in Seattle, I heard a very clever doctor speaking, Dr. Alan Gaby. Alan Gaby is the past president of the American Holistic Medical Association. And he said that whenever a patient comes to a doctor with a condition that's a functional problem, and particularly if it's been labelled as NAD, no abnormal diagnosis, it's a garbage can diagnosis. So the physician throws the patient in this garbage can and hope to hell that the rubbish man takes the garbage can and the problem away, okay? Because they know that there could be one of a myriad of causes, and usually it's stress-related, all right? Personally, I believe that half the patients I see with IBS have got stress, major stress, and they don't see the link between the stress and the functional gut problem that's been created as a result. Did stress directly cause the gut problem? No, but stress made the person change their diet, made them change their lifestyle, made the person stay up at night, made them snack inappropriately, have inappropriate relationships, get more involved in porn or vice, get more involved in cannabis and the sugar cravings, get more involved in alcohol. So there'll be different reasons why people get screwed up like they do. But if this stress is addressed first, or the reasons why they had all these inappropriate behaviors leading to it, it would have stopped it in the first place. Okay? So never discount stress. If you're in a stressful situation now, if you've got a gut problem, that's the number one thing I want you to tackle. Before you do the diet, I want you to get this crap organized. Because not only is it going to help the bowel, it's probably going to help improve you immensely overall. Your relationships with special people around you, your income, lots of things will improve when this crap's been resolved. So what the hell is it? You need to get this sorted. Talk to someone that you can trust, someone that you can speak to. Don't just keep it bottled up inside. Lots of people I talk to, within 10-15 minutes of talking to them, they start to cry. They open up and they tell me all these problems. Right? Because a lot of people have got stuff bugging them, it's on their mind. So those are the sort of things I want you to think about. That's what I call the lifestyle component, okay? The lifestyle needs to be sorted because this is a functional complaint. This is not pathology of the bowel or disease as such. This is something wrong with how the machine is working, all right? So get that sorted first. Try and look at some of my videos I've done on autonomic nervous system dysfunction, on sympathetic and parasympathetic imbalance. This plays a massive role in getting the gut right. That plus the diet. If you're going to eat really, really good foods. I mean, some people say, I eat very clean. I eat really clean. But they're bloody stressed out of their brain. Well, you might as well drink bloody paint strip as far as I'm concerned, okay? I've seen many people eat shitty foods and shitty diets in good health. I have. I'm not lying to you. And I've seen a lot more people eat really clean, the best diet, and feeling crap health. I've seen plenty of those too. All right? Think about that. It's not just about what you eat. It's about how you feel, how you relate. A lot of things account for health. I've said this on many of my videos. So getting A sorted, the stress, the obstacle to cure, the emotional obstacle to cure, or the problem that you've got. Could be a lack of income. It could be that you're pissed off with your mother-in-law. It could be that you haven't had sex for 2 years or 5 years. There could be a lot of reasons why you're not happy. Right? And if you're watching this video now, you're probably already starting to think about some of those problems. So think about that. And the food, common sense. You need to eat good, healthy food. We've spoken many times about this in a lot of the videos. You know what to eat. If not, check out one of my hundreds of videos I've created on healthy eating. Foods to eat, foods to avoid. There's plenty of information about that on the internet. And supplementation will help you. It's not mandatory, but it's going to help to clean up the gut. So if we put the whole thing together, assessment, understanding cause and effect, removing these stressful obstacles to cure, taking maybe some supplement to help to speed up the process of getting the gut back on track, and of course eating the right kind of foods. That really, in my mind, is the best treatment for IBS and the best treatment for a lot of chronic illnesses. Thanks for tuning in. Catch up with you in the next video.